Hi, friends. Welcome again to another episode of Beyond the Clouds Edge to Edge Transformation. And this transformation is engulfing every part of our life. And definitely, healthcare, how healthcare is changing is amazing to watch. And I learned a lot from Sergey. Sergey, you've been doing a lot of writing. I truly appreciate that. Can you tell us how you became the Sergey we know today?
Thank you for having me, Shankar. It's great to be here. I had a great family beginnings back in my home country, Belarus. I learned really early how to survive. We didn't have much. And also the value of education and science, mainly because of my father. He's a mathematician and theoretical physicist. That's the person who instilled the love for mathematics in me. I still really enjoy reading math papers and doing some calculations from time to time. I came to the US partly because of the political processes that were going on and still are ongoing in my home country, Belarus. There was some poor leadership and dictatorship that unfortunately was instilled in Belarus right after the breakup of the USSR. Unfortunately, those people are still in power. Back then, as a student, I was trying to make sure that my country is free and we have some good life. I was very active as a student, and unfortunately, the government, the authoritarian regime took notice, and it became just very dangerous for my life. At the time, it was a pretty hard decision. I still had a lot of friends there and family. I decided to pursue something outside of the country, in particular in academic circles as a grad student and then as a researcher. That's how I came to the US as a graduate student in economics. Once I got my math degree, I started looking around where I could apply my mathematical knowledge. I've read quite a few papers in economics and finance, and I found very interesting how they use pure theoretical models to apply them to real life economic systems. The main reason this whole journey started is the freedom. I feel like all of us humans, we need freedom. I feel like in the United States, when we have it from day one, from our birth, we don't appreciate it as much. When it's somebody like myself or yourself who came as immigrants, I feel like we have great appreciation. We value all of the freedoms and liberties we have in this country.
You remind me of the story of many, many immigrants, whether it's political freedom or it's economic freedom or the freedom of thought to do different things. And I truly appreciate that. How did you move from one field to another, economics to now? You've done a lot of interesting work in healthcare and AI. And can you tell us about your journey through that?
Yes, it's been quite a journey, both professionally and on a personal level. I'll be honest with you, there's been some really great, successful stories on the way up, but there are also some really hard situations, unfortunately, and adversity to the extent that there were times where I was really thinking, what am I going to do next with my life? How I'm going to represent myself as a person, as a professional. It wasn't just a smooth ride. The values of hard work, family values that, as I was saying, were instilled in me eventually paid off. The education that I got, I was very fortunate, especially in mathematics, statistics, and later on data science. When I was in grad school, I wrote a couple of academic papers in finance, but also I continue working with my dad. He is a mathematician and theoretical physicist, in particular in the field of thermodynamics. I just fascinated how elegant some of those physics laws are. You can just look at the formulas and derive a law that represents a motion of a tiny object in space. It's funny, that's completely opposite from data science. You don't need as much data because it was already experimented on. So some of the laws have already been proven and you're just ripping the fruit of that labor. There are some areas that are really interesting from a theoretical standpoint. I almost did this full loop from complete theoretical work to now being in data science. But again, it started in economics, especially at the time. There were a lot of interesting mathematical models were applied in economics and finance. We had Nobel Prize winners, Merton and Scholes doing some interesting work in option pricing at the time in the late 90s, early 2000s. Got a job on Wall Street in risk management and later portfolio management and also in financial modeling. All the math behind some of the financial models, insurance models. So it's been interesting. I spent a good chunk of my career in that area. I've also learned a lot on a personal level, professional level. I've met some good friends, but I also met a lot of people in finance for wrong reasons. They're looking at you as a source of connections or lobbying. Finance is a very unique field, very cutthroat, I would say. This is where I spent most of my career. The journey to medicine was almost an accidental one. 4 years ago, we had a restructuring at a company I was working for, and I was looking for new opportunities. I got together with one of my friends, who's my current business partner. He was also in finance, but on the opposite side, he was producing some fintech and risk management products. I was using those products. We got together and he said, I did some work in bioinformatics. There's a lot of interesting areas where we could use your expertise as an AI expert and maybe build something. Both of us are math guys, not necessarily experts in healthcare or any of the medical fields. We found some interesting connections, interesting people who we work with and build around, where we found out some areas that need to be addressed.
Oh, that's fascinating. Our journeys shape the work we do. You've been writing quite extensively about what's likely to happen in healthcare, digital health. Could you tell us briefly about what's happening and what we can anticipate?
That's the question I've been asking myself for the last, I would say, couple of years. Just to add to my previous story, as I started working in digital health and artificial intelligence, I've got to know a lot of people on both sides of the spectrum of healthcare in different areas, both on a clinical side, but also on academic side. There's a lot of great research going on. I got to meet some people in genomics research, and they invited me to be part of the working group in the middle of COVID. Some of the methodologies and algorithms we developed at my current company, AI, they were very attractive at the time when a lot of answers needed very fast. I got to know a lot of great researchers, and we founded this working group in AI and genomic diagnostics as part of the International Federation of Clinical Chemistry and Laboratory Medicine. A lot of big philosophical questions came out of being part of that group. How do you take all these methods that are seemingly being developed every couple of weeks? We're working in the area where we have to be cautious. We have to know how these models operate. As part of that working group, I started working on some areas of transparency, explainability, and best practices in AI. Published a paper on that. So some of the questions you're asking, this paper has direct answers to it. But there has to be a balance. We have to be very careful with regulations. I welcome, for example, what's happening in European Union. But at the same time, as I was reading through that document, I feel like the freedom of innovation definitely has to be addressed. We have to be putting guardrails on some of those models, especially in medicine. But at the same time, the innovation, especially in AI and digital health, is what's going to be the future of healthcare. People who are cautious about that statement, people who are asking questions, those are all the right questions. At the end of the day, it's the technology that's gonna move things forward in healthcare. I see that every day. On a daily basis, I'm talking to a lot of primary care physicians and other specialists. It's just amazing that people still using faxes. We have electronic health record system from the early age of DOS. It's funny, we're coming up with these great technologies, but then we're facing platforms that people are working with right now. We're trying to connect the two. We need to continue to develop best practices, in particular in digital health, because of such a rapid advancement in AI. At the same time, I want to be clear that it's especially for small company startups, we don't want to kill that innovation. Innovation is the key in digital health.
Very true. Newer technologies are quite easy to use. Is it possible that they can leapfrog and upgrade themselves to what we have today?
Yes, it could also take time. Let's be honest, especially in healthcare and digital health, no matter who you are, it's hard to make predictions, especially 1 year ahead in an industry that's been so full of inertia, so full of this monopolistic power. The fastest way to change the industry is do something drastic in terms of the structure of the industry. Just looking historically, what happened in other industries in the 1980s in the US. We have software monopolies in the 90s when the Department of Justice broke up the Microsoft browser into two separate businesses, and that opened up competition. It's my belief that companies like Google were born because of that proactive stance that regulators took. In healthcare, you're looking at FTC and also Department of Justice, Federal Trade Commission. They've been doing a lot of great things. At some point, you just have to sit down with the stakeholders, with the regulators, perhaps with CEOs. Definitely physicians should be part of that conversations and think, what should we do to benefit the patient in the end of the day? All of us have to take a hard look how to change the industry and how to perhaps even deregulate, as happened in other industries. Once that monopolistic power is shaken, you see so many great developments, so many adoptions. I see the resistance from these big players, from the incumbents of the industry. A lot of them don't want innovation. Even the innovation that could become part of their business almost seems irrational to me. Certain companies, certain people are used to doing things in a certain way. They like the status quo in healthcare, even to the detriment of the patient. There has to be a conversation going on. Even organizations like American Medical Association, we need to have that discussion. Data scientists and researchers in general should be part of that conversation as well, because that technology is the future. And I wish that happens in my lifetime, that we have an innovation and it's pretty quickly being implemented in our daily lives. We have to continue working, and this is what we're doing on a daily basis at Will AI. With all the organizations I've been involved with, everything we do, all of the innovations we do has to be to the good of the patient. Also, people who surround the patient, the whole ecosystem, providers, nurses, receptionists, the whole ecosystem around the patient.
Do you think the slowdown in the industry is primarily because of inertia and vested interests? Or is this the risk averseness because they don't want to kill patients? What is really going on, in your opinion?
It's a very unique industry in the sense that, first of all, you don't want to hurt the patient. That's all physicians are taking. All of us who are not physicians should also think this way. We should take an effort in preventing that, which is very different from areas where I used to work, finance. You make a mistake, you lose some money, and apparently life goes on, as a lot of these crises have shown. Nobody gets hurt, even though people making some huge mistakes, including myself. The caution part is a factor in sort of preventing some of this new advancements proliferating through. It's also the culture of this industry. People are used to doing things in a certain way. I talk to physicians and nurses almost on a daily basis. They're very proud people. They have a lot of respect from their patients. A lot of the partners we're working with, a lot of physicians, they understand that technology is the future. And we've been successful to work with some of them. They know that not even the most brilliant physician can take all of this information we have in the world. It's impossible to absorb it, to read all these new medical studies. We have around 1,000 new articles being added to our database every day. There is no way any human can read all of that. There are so many areas. You mentioned drug development, drug discovery. There's a lot of potential there. Anything where you have inefficiencies, where you have nonlinear processes, where it's very hard for human to comprehend, that's exactly where you need AI. Just want to summarize what I've talked about. People are concerned about safety in healthcare of AI. Then we have the fact that people are used to work in a certain way. The third thing that is very important is the business part. A lot of these innovations, they need finance. You can have an innovation that just sits there on the shelf. Until you have those partnerships with physicians, with some investors, that innovation is not gonna get to the end user. Healthcare, unfortunately, is an area where it's not easy to have a high margin business that we see in other areas like finance and technology. That's my third argument of why it's so hard to advance all of these technologies. Definitely places like drug discovery and genetics have a lot of promises and a lot of financial support. But other areas that we're working with in my company on a daily basis, like primary care, it's a hard area. It's not something where you would say, let's make a lot of money in this area. If you have this mentality of using technology, using innovation to help people first, sometimes we have to make those decisions. Are you in it to make a lot of money, or are you in it to help people? If you're fortunate, you can do both. In a lot of the areas of healthcare, you cannot do both. Maybe down the road, try to develop something that's scalable and help your investors, your partners to also make money.
Sergey, you made a very good point. There are so many nonlinear processes when it comes to healthcare where AI can really help. Can you give examples of that where there is progress or potential progress?
When I co-founded Well AI with Daniel, our basis was scientific. We're both researchers, we're both mathematicians. We started with a scientific model that just happened to use some of the more advanced AI methodologies. It was interesting because literally a few months later, the COVID pandemic started. We have this great model and the data set we've been working on for over a year, creating the very unique data set of medical terms. Honestly, we have one of the most extensive ones. We started to think, how can we help? How can we use our knowledge of AI and in particular data set of 30 million medical studies to perhaps advance the knowledge of developments in COVID, potentially save lives. I have to give credit to my team. We have some great engineers. In 2 weeks, we basically created the brand new product. It was a very simple idea. You open the app, choose the area of your expertise. If you're a genomic researcher, chances are you're focused on a very narrow area. If you talk to genomic scientists, out of 100,000 genes that are out there, they only know 2 or 3, but they know them very well. They know what factors being attributed to those genes. They know how those genes perhaps affect some of the processes in human body. They know maybe connection between those genes and certain diseases and symptoms. Through the knowledge of literature, we mapped every single medical term, being it a genome, a protein, a symptom, a medical test, we took from the great data set and essentially created a separate data set of just medical terms. What we have is the nonlinear relationship between all of those medical terms, a huge covariance matrix where the connections are not linear. We know, at least in our estimation, how strong particular term relates to the other. So if you're a genomics scientist that's been just dealing with this particular 2 genes, we can tell you the fastest way to perhaps use your research to apply it to COVID infection research. What we realized early is that in most areas of medical research, scientists from one area don't talk to scientists from other areas. If you're a genetic researcher, you have your own conferences specific in genetics. If you're infectious disease researcher, you just focus on those conferences, you publish in those papers. Very rarely we see a leap toward a different area, which could be adjacent to your area of expertise. So what our tool is doing is to have those nonlinear connections, to find that relationship between what you're doing with a particular gene. This is how this new working group started with that tool. Some scientists notice our work and they're like, oh, this is great. It could help with developing some of the tools that could help COVID. It could be used for many other things. And again, it's this idea that humans cannot easily comprehend relationship between one particular medical term like protein or gene with something like disease or symptom, for example, from a completely different area. So that's our contribution.
I find something very interesting going on. On one hand, there are newspaper articles that say within 10 years we'll have the technology for people to be immortal. They don't have to die anymore. On the other hand, even basic preventative medicine is not available to a lot of people, even within the United States. Have you been looking at what's happening?
That's an excellent question. And it goes kind of to the heart of the problem that we have in America. I feel that there's so much great research. The US is the foundation of so many great innovations. Where you are in San Francisco, Silicon Valley, there are a lot of great developments, but access to some of those tools are easier for people in certain areas with certain social status, certain income level, and unfortunately not necessarily accessible to the general population. Over time, spread out, the costs of producing certain things come down, that particular innovation becomes available over time. In healthcare, that journey of that innovation takes much longer time than in other areas, unfortunately. I'm just looking at the data. What do you do? How do you get the newest and the best technology to average Americans, perhaps people who don't have access to certain things, maybe who live in rural areas, maybe underprivileged? I don't have an easy answer. Perhaps how can we improve it through deregulation in this particular case? And again, there has to be a discussion. We should try to remove the silos and involve broader groups of people. As I said, policymakers, physicians, venture capitalists, scientists, how to solve the problem. Just a quick story. When Daniel and I started Well AI, it started as almost an emotional journey. It was just a year or two after his father passed away from cancer. I have a genetic eye disease, which I'm looking very closely into right now because it seems like it's part of my history, where other industries have made so much progress. As I told you, both of us came from finance and things move much faster there. We were shocked how many problems healthcare has. The initial idea was to help people who are underprivileged, to help people who are in rural areas of low income, to give them access to information. This was our first idea. Build a free app. You can use that free app to essentially get any medical information you need, even if you're 100 miles from the closest medical center. What prevented us continuing in that area is the daily life of a startup. Going direct to consumer, it's a very challenging area. For example, venture capital is considered that as a risky area. You have a lot of liabilities. Again, coming back to this issue of safety in finance, you need to have some liability protection. You cannot just sell you up out there. I feel like a lot of startups face the same issues that we faced because of those obstacles and also because of the monopoly power. I don't think some of these healthcare giants want somebody like us or any other startup to go directly to their patients, pushing some app. They want to control that environment. They want to control their patients.
I've seen it myself, not just in my venture, but having talked to many other companies that are in health tech. There are many obstacles: regulation, monopoly. A lot of it is people dynamics. To people who are listening out there, it's time we pay attention. It is time to democratize at least healthcare access and hopefully healthcare research. There are real opportunities for curing diseases, even preventing diseases, living healthy longer, today accessible to the privileged few. So I want to see this available to a large number of people so that we can live healthier, happier, and also in a way that's more harmonious with nature. Thank you for bringing up this issue, Sergey. I've been reading a lot of things that you publish. And to people out there, please participate in understanding the complexities of the healthcare system, how medicines are made, how medicines are delivered, so that we can at least participate in a democratic way.
I'm staying an optimist. That's why I'm still in digital health. In the end of the day, innovators and people with ideas, especially the ones that are helping the patient, they're going to succeed. We have all these obstacles and they're there for a reason. History is on our side. The most innovative ideas are the ones that are going to stay. They're the ones that are going to help patients, help physicians, and help all of us. Please follow what I do. Digital health and AI and machine learning is the future of healthcare.
Thanks again for the optimistic note. And to people out there, I'm always looking for different ways of looking at problems. There are many complex problems. The simple problems have been solved, but complexity is very much there in every part of nature. Therein lies the opportunity to get to the next stage. Thanks again, Sergey.
Thank you, Shankar. I appreciate it.